patient's room. Hi, I'm Jessica. I'm a student nurse at Bell State Community College, and I'm here to do your wound dressing today. So the door's shut. I'll make sure the privacy curtain's pulled, and I'll check my physician's orders. And they're for Thomas Jones. I'm supposed to change his dressing at 0800. His birthday is 03/27/1968, and it says change dressing using sterile technique, clean wound with sterile normal saline, pack wound with saline moistened 4x4s, and redress with 4x4s and ABD pad. Secure with paper tape. And it says his allergies are penicillin and nuts. So I'll ask him about that to confirm. And I'll also check his RMN for his name and date of birth. So Thomas Jones, 03/27/1968. So first, I'll go ahead and perform hand hygiene. And I'll don clean gloves to take off the old dressing. And I'll check to see who signed it, what time they did, and all that. And I'll pull the tape off. I'll also pre-medicate my patient about 30 minutes prior because this will be a little painful probably. And I'll grab it, pull it back, pinch it together. And I'll look at the bandage for Coach, and I'm looking for color, odor, amount, consistency, and how the patient is tolerating the wound. And I'll go ahead and dispose of this. And I'll go ahead and take a cotton tip applicator. Well, I can wait. I'll go ahead and measure the wound first. And I'm also checking for RETA, and that's redness, edema, ecchymosis, drainage, and how well the wound is approximated. And I'll go ahead and measure, and it's about 6 inches or 6 centimeters by 5. And I'll take my cotton tip applicator and stick it in the deepest point. Well, I'm not trying to culture it. I'm supposed to measure right now. So I'll get it, and I'll say it's about 2 centimeters. So I'll take all of this, remove it, throw it away. And I can perform hand hygiene again if I need to. And I'll go ahead and set up my sterile field now. So I'll grab a corner of it and pull it up and let it fall without touching me, and I'll keep it above my waist. And I can grab another corner and I can lay it out, and you can touch the edges because it's a 2-inch border around it. So next I'm going to go ahead and I already have my tape ripped off, so you'd want to do it first before opening all your supplies to keep less contamination. And we've already been opening these, but I would rip this open and I would drop them on my field. And then this is, we're gonna call it my culturing one because we didn't get the kit, so I don't have it. So I would drop this. And I would also, we've already opened my combine pad, so I know this isn't sterile, but I would open the package and I would drop it onto my sterile field. And now I'll reach around, you don't want to reach over, and I can go ahead and open my gloves. Well, first I probably should do my gauze. So you'll pull the packaging open without touching anything, back and over. And one's gonna be dry and one will be for the wet. So I'll grab palm to label, open your cap, put it face up, and I'll first lip it 5 to 10 seconds into my garbage, and then I will pour into my 4x4s, and I'll put the lid back on. So then I'll come over and I'll do my gloves. So we had to make this. So I would open it farthest away from me and then closest. And I'll grab this part and slide my hand straight in. And then with this hand, I would grab the cuff, get a good grip, and slide my hand in. So now I cannot go but like below my waist level, and I can fix all my supplies as I need to. So now that I'm ready to actually clean my wound. So first, you can pick up by the corner of your gauze, kind of wring it out, and you make a little triangle wonton, and you go from cleanest to dirtiest. So I'll wipe right down the middle first, dispose of it, grab another, wring it out good, and go farthest away from me. So I'll go around, dispose of it, wring it out again, and go closest to me. And now I'm gonna pack it. Or first I'm gonna do my culture. So I'll get it, I'll go in the worst looking spot in the wound maybe, and kind of twist it around, and I wouldn't go all in it. And I would send this off to lab, so you can sit it to the side, and when you're done you can send it to lab. So next I'll get my gauze and I'll pack. Get one of my Q-tips or cotton tip applicators, and I'll tell my patient, I'm sorry, I realize this is painful, just take a deep breath and bear with me. And since I had to use a very small potato in this, it doesn't really fit, but any excess you would cut it off, because the wetness of the bandage would cause breakdown of the skin, and you wouldn't want that. So if I had scissors, I would cut off the excess of this to make it fit better. And then I take my combine pad and I kind of pinch it together and sit it on. Go ahead and get my tape. I'm just doing my window pane taping on this dressing. And then I will do a piece of tape that has my name, the time, and the date on it for the next person to know, or for me to know whenever the last time the dressing was changed. So I can go ahead and remove my gloves. I got a lot of powder in these, my hands are hot. But I would clean up everything and dispose of everything. I would send my culture off to the lab. I'd perform hand hygiene again. And then I would lower my bed, keep my bed rails up, and make sure my patient's comfortable, the call light is in reach, ask if they need anything else, and I would document.